This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. This is Mon Health Talk. I'm Dave Wilson. Our guest this morning is Kim Liston, Community Program Coordinator, Mon Health Preston Memorial Hospital. Good morning, Kim.
Good morning.
We're going to get into, there are several events coming up this month out at Preston Memorial Hospital in Kingwood. We're going to get into those, but first, let's talk about you. How's that sound, Kim? Let's get a little more information on your background. Just tell us a little bit about yourself, your background, education, where you're from, and how you ended up with Mon Health, all the good stuff.
Sure. I'm actually from Kingwood, so I was born and raised here in Preston County. I'm just lucky to be back in my hometown working. I've been here for 10 years. I have a bit of background in community work, so I got my bachelor's and my master's in social work from WVU, not too far from home. And so I'm just kind of lucky to be back here in Preston County and doing the work that I love.
What drew you to that kind of work?
Well, I kind of started young. I did a lot of outreach and volunteer service and those kinds of things, but I always liked how the community worked among partnerships to kind of tackle fun events for families, but also some health outreach, which I thought was really awesome to be able to do those kinds of things in the community. And I thought, I'd like to help people, so I wanted to do something along that line. And I've been here for 10 years, started a long time ago, but good community, really enjoy this place and the people that I work with. And position came open, and they said, hey, you want to do some community outreach and work with volunteers? And I said, sure, this would be awesome.
Well, I was about to ask you how you connected with Mon Health, but it just seemed like right place, right time, right situation, all came together there.
Yeah, we have really good community here. Somebody reached out to me, let me know a position was open, and I thought, this is wonderful. I've worked with volunteers before. I've coordinated student rotations. WVU, I worked in the Center for Service and Learning, I think is now the new name of it. Just a lot of great connections that you can make with people in the community.
So explain your role a little bit more as the Community Programs Coordinator. What all does that entail?
Sure. So I coordinate, train, and recruit volunteers for our hospital, and they serve in a variety of events such as blood drives, health fairs inside our hospital as well. I also coordinate our student rotations here. So when they do clinical rotations for so many hours in so many different departments, I help to coordinate those rotations and get them connected. And then I also do our community outreach. So we do a community health needs assessment every 3 years to find out what are the needs in the community. What do we need to help bring into our community? Is it more screenings? What type of screenings? Are there any health issues we really need to be focused on? So we do a lot of outreach around that, going into the schools, talking with families and students about different health issues, everything from vaping and e-cigs to breast cancer awareness, to getting those free, either free screenings or low-cost screenings at our health fairs. So doing a lot of outreach in that way.
Who, not specifically by name, who are the volunteers? Are they young people? Are they students? You get folks from all walks of life just wanting to help. Who are the people that you get to work with every day?
We have a variety. A lot of my folks who are here during the day are retired. It's hard in Preston County to find somebody who's retired and wants to do more work. Sometimes we have folks working well into their 60s, 70s, 80s. Around here. So we try to find somebody who is willing to come in for even 4 hours. I say, give me 4 hours one day a week. That'd be fantastic. So I have folks in here that greet patients as they come through, kind of direct them where they're going in our beautiful facility. Sometimes they get a little lost, and so they kind of help them along their way. Some are just looking for something else to do. We have very engaged folks, and they're like, what can I do to help? And so especially over the pandemic, we got some phone calls of, hey, I'd like to volunteer. What could I do for the hospital? So that was really cool to see. We do have some juniors. A lot of times they can start at the age of 14. Those are called our junior volunteers up until 18, of course. So they do a lot of help in the summertime, and we also try to get them a little more exposure so they can see a little more of the hospital. Is this something they want to do in their future? They also help do a lot of fun things like build our float for the Buckwheat Festival. So,
which is this week. It's this week, right?
Yes,
yeah.
It's very, very soon. Absolutely. We think we're all ready to go. We just need to throw a couple little decorations on the float to bring us to the fall, and we'll be ready.
We're talking to Kim Liston this morning, Community Program Coordinator, Mon Health Preston Memorial Hospital. There are some events coming up at Mon Health Preston Memorial. We'll get to get more details on those events coming up as we continue visiting with Kim here on Mon Health Talk on a Monday morning on the Voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Kim Liston is our guest this morning, Community Programs, plural, Coordinator, Mon Health Preston Memorial Hospital. And it's hard to believe, Kim, we're just a couple of days away from October. And, of course, October is Breast Cancer Awareness Month. What kind of events do you have planned for Breast Cancer Awareness Month at Preston Memorial Hospital?
Well, we'll start off on Monday. We'll go out and put up pink bows around the town here in Kingwood. We got permission from the city. We put up these great big pink bows along the light poles. They look very nice. Kind of draws attention to, hey, it's October, just reminding women to get your mammogram and spread the awareness. There are so many people touched by those that have had breast cancer. So then the next day, actually, we start that off on Monday, and then Tuesday we go to the county commission, and we'll do a breast cancer awareness proclamation there. Take a nice picture, put it in the paper, raise awareness again, and then we have a health fair on Saturday the 8th, and so we'll be highlighting mammograms there and what we're doing for all our pink events, and then we have one of the coolest things we've been involved in here over the last 10 years is what we call pink outs. So these are athletic events in most cases where folks were encouraged to wear pink. A lot of times we do awareness booths at these events and give out free promotional items and talk to people about our Pink Fund, give out information on what that is. We now have 3D mammo, so we kind of tout that as well. But some of these events actually have ended up with a check presentation where these students have raised money to donate to us to help women. So we've got a very big, long month, and we are going to be involved in 4 different pink outs, and then there's a couple other events happening in there where we'll squeeze some pink information out as well.
Talking to Kim Liston this morning, since we're talking about October and Breast Cancer Awareness Month. Of course, I think it goes without saying, maybe it doesn't, that mammograms are essential to catching breast cancer early. So can you just give us an overview of the services that are available there at Preston Memorial?
Absolutely. Yes, we do. One of the most exciting things for us right now is we do have 3D mammography. That is super important because women sometimes can have a regular mammogram, and they're like, we might see something, we need you to come back. So a 3D mammography actually helps us to detect a little sooner. Also, it helps us to eliminate the, not sure, there might be something happening, let's do another different type of scan to see if we can see that, or an ultrasound. So it actually can help us in diagnosing that quicker and a little more accurately without causing more stress on someone.
For patients who may need support, maybe I don't know what their financial situation might be. Are there support services or ways to help those patients out as well?
Yes, absolutely. We have what's called a Pink Fund here at the hospital in our foundation. So we offer this fund to help women who need either a mammogram or maybe it's an ultrasound after they've had a mammogram. If they do not have insurance, we offer that fund. And it is, of course, depending on funds that we have, but over the years we've been very, very lucky. For 10 years now, the students have raised money here in Preston County, and we put money into that fund, and we have had some other donors in the community that have heard what we're doing and what the students have been doing, and so they've been donating to that fund as well.
How did that all get started?
Well, that's pretty impressive. In 2012, we talked with the high school football coach and students, and we said, hey, they do pink outs across the state. Would this be something we're interested in doing? Would you guys let us come and set up a table hand out some information about breast cancer awareness. And they said, oh, yeah, we can do that. And, so in some form or fashion, all the students and athletes wore pink, whether it was a hair bow or whether it was socks or whatever it was, according to the guidelines, of course, for football. And so we just were looking for awareness, and so we just wanted to be a part of that. And after the event, the students came to us and said, hey, we have money for you. We want to give this to help at the hospital. We want to help women. And so we established a Pink Fund, and that's what that fund does. And every year that they raise money for us, we put that in that fund. And, of course, others have heard, and so they want to donate to it as well. And we do have a little event we do here at the hospital for just employees that they want to buy shirts to wear on the Fridays of the month. And so we are buying those shirts, and that money gets donated into that Pink Fund as well. So the staff have joined in as well, and they want to support what the students started.
How awesome is it to see high school students, school students in general, getting involved in supporting this? We like to rag on them all the time. It's all their fault. The world's, falling apart. But to see them get involved is pretty awesome, isn't it?
Oh, it's amazing. And actually this year we got a call from Central Preston and West Preston. They're going to have a volleyball game. And so this is a middle school. And they asked us to come over, and they said, and I thought, oh, that's cool. We're going to have another pink out. And they're like, well, we want to do a check presentation too, which was amazing. We're like, that's just absolutely wonderful. We have a very good group of students around here, and we try to partner with them however we possibly can. And so it's wonderful to see that come together. And we, of course, offer, at that same event, we'll do a booth and that kind of thing. But it's just wonderful to see the students getting involved.
Talking to Kim Liston this morning. She's Community Programs Coordinator with Mon Health Preston Memorial Hospital. Got to squeeze in a quick break. We'll continue our conversation in a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Kim Liston is our guest this morning, Community Programs Coordinator, Mon Health Preston Memorial Hospital. It's going to be a busy month. And Kim, is there a health fair coming up soon?
Yes, there is. We have a health fair on October the 8th, and this is actually held at the Fellows-ville Elementary School. So it's from 7 to 10 a.m., pretty early in the morning. We know folks like to get their blood drawn quickly so they can go about their business and eat. That's a big thing.
Yep.
But at this health fair, we have what we call low-cost blood screenings. Oftentimes when folks are asked by their doctor, hey, we're going to get you need to get your cholesterol and some other things checked, a lot of times they'll use insurance, or maybe they don't have insurance, and those can be very costly and sometimes even costly with insurance. So we offer them at a very discounted price. So for $35, they can get what's called a multiphasic screening through us, and it's a pretty big panel, up to, I think there's 30 different tests in there. But the big one is cholesterol. A lot of people want to pay attention to that. Some of these screenings can help them find out if, what are their risk factors for other chronic diseases. Maybe their sugar's a little out of whack, and they're like, uh-oh. So they might ask, let's try this other test. And we do have some other tests during that event. We have a PSA. We have a hemoglobin A1C. A lot of folks that are diabetic use that to help them determine over the last 3 months what does their blood sugar look like. They have a TSH, a vitamin D, vitamin B12, and folate. We also offer blood typing. That's something that folks sometimes don't know what their blood type is. If you're a blood donor for the Red Cross, a lot of times you'll know. But unless you are, most people don't know unless they need to know. And so that's something we offer pretty cheaply as well. It's like $10. So some people like to know, especially young folks. They're like, I wonder what my blood type is. And, we've had some 18-year-olds come in and want to get their blood type done. So,
do you find people are more relaxed in the health fair type setting rather than going to the doctor to do, to get this blood work done? That doctor's office can be intimidating,
Absolutely. Well, and we all have those folks. I know when I go to the doctor with my family members, everybody younger than me or older than me is like, yep, don't want to do this. And it can. So at the screening, good point, we offer blood pressure screenings. And so as they're walking around the room talking with different vendors that we have there and just chit-chatting, they'll sit down, they'll be like, hey, we're doing free blood pressures. You want to get your blood pressure checked? And a lot of folks are pretty good about getting their blood pressure checked or wanting to. If you offer it, they'll say, sure, I'll sit down. And a lot of times, like you said, some folks that go into a doctor's office, their blood pressure can be up because they're stressed or they're nervous. And sometimes at this kind of event, they're not as stressed or nervous because they see so-and-so who was their neighbor or so-and-so who was their daughter's teacher, so it puts them in a little different atmosphere. And they might be more apt to ask questions that maybe they wouldn't normally ask or they forget to ask because they're so stressed during a doctor's visit.
Oh, I have a story for another day, Kim, about being a little worried at a doctor's visit and the blood pressure being a little out of whack at that very moment, but I'll save that for another day. In all seriousness, and not to be overly dramatic, I know people personally who credit the health fair for catching very, very early stage cancer because numbers were out of whack, as you put it, when they got their blood work done. And they said, if I hadn't gone to the health fair, I would have never known.
Yes, and folks who are in their 40s don't always see the value of this kind of health fair, but even just getting started a little earlier, even in your 30s. I mean, we have students that we worry about that, they really encourage, go ahead and get some blood work on just to see where they're at. And everything from, your sugar levels to cholesterol to some other things that are in there that your doctors might look at, maybe your iron for females. So it's never a bad thing just to see where you're at. Just with mammograms, same thing with women. They say, let's get a baseline, let's see where you are so we can compare it. That's helpful as well because you can see, has it come up a little bit? That's come up a lot. Maybe we need to check that blood work again. So it does help stay on top of things. We've had folks tell us that they caught a leukemia, for example. They had some really out-of-range scores that they weren't really sure about. And we've had people come back to us and say, if I hadn't gone to your health fair, I might not be here. And those are stories that they stick with you over time.
Kim, where can folks go to get more information on the health fair, on Breast Cancer Awareness Month, the Pink Out, the Pink Fund, all the things that are coming up this month?
Absolutely. They can go to our website, monhealth.com/health fair. There's events listed on there. They can also visit our website. When you get on monhealth.com, there's a Preston Memorial website. You can go that direction. We also post all of our things on the West Virginia Hospital Association website, so we're posting information on there as well. They can also contact me here at the hospital, the 304-329-1400. They know me here pretty well, so if they say, I'm looking for Kim Liston, they know exactly where to send them.
Kim, enjoyed the conversation. Good luck with all the events coming up here over the next month.
Thank you. I appreciate it.
That's Kim Liston, Community Programs Coordinator, Mon Health Preston Memorial Hospital, our guest this morning.